Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Patients often accept dental treatment as a necessary evil, something they must do and get over with as quickly and as painlessly as possible, both physically and financially, without ever knowing how or why it's being done. Part of the problem lies with the dentist in communicating the treatment plan to the patient. It's important to remember that communication here means a two-way consultation procedure with feedback from the patient. There are many ways of communicating this material to the patient. We have found that an effective time is somewhere between the second and third appointment or patient visit. Before this consultation takes place, the dentist has prepared himself by completing several steps. He has probably taken a health history and has done an oral exam, a complete oral exam on the patient. He's then taken full mouth radiographs. If the case is extensive, he has probably prepared some study models. Then he has outlined the treatment plan that he's going to present. Again, if the case is going to be involved, he has probably pre-selected some visual aids or other educational material that will be helpful to him in the presentation. When he has a large treatment plan to present to the patient, it may be helpful for him to have a dry run of his presentation, which may even include taping the conversation on a small tape recorder and listening to it before the patient arrives. We'd like to present our idea of an effective model for communicating a proposed treatment plan. There are 3 steps. The first is understanding the problem. This includes understanding the conditions present in the patient's mouth and showing these to the patient. Also, you must talk about the consequences of these conditions if they are not corrected. The second stage is correcting the problem. The dentist will explain what the treatment will consist of and what the benefits will be to the patient after having received the treatment. The third stage is finalizing the presentation. This includes giving a summary of the treatment plan to the patient. It also informing the patient of the time investment that will be required of him. At this time also, we should discuss the financial investment that will be required of the patient. At this point, it should be ascertained if the patient has an insurance plan that will be available to him, and this should be included in the treatment plan and discussed at this time. When this has all been done, the patient must agree to the treatment plan. Once the consent has been obtained from the patient, the dentist has the okay to go ahead with his treatment plan.
To demonstrate this, we visited 3 successful dental practices in the state of Michigan.
In the first sequence, Dr. Marcotte begins his explanation with the differentiation between normal and abnormal. Please note his use of charts and drawing as he translates these things to language that the patient can understand.
The problem is really this. On the inside of this booklet is a chart which shows the way the tooth is formed. And what's happened to you, if this is a model of your teeth, and this is the way the teeth come together, and these teeth are all removable, and the teeth just fit down into the jawbone exactly like this, and the teeth fit in this area, just like that. Now, there's really nothing to hold those teeth in. And as you see here in this cross-section, there's nothing to hold. If this is the tooth and this is the jawbone, there's nothing to hold these teeth in the socket except these little tiny delicate fibers, which we call the periodontal fibers.
Right.
Now, what I'm talking about in your case is that the problem is bacteria has entered in along this crevice and has begun to destroy these periodontal fibers. And this is the process of periodontal disease, periodontal tooth and disease. And it's very difficult because there very seldom is any pain or any problem with it, and someone like yourself comes and we think the problem is perhaps to the tooth because that's always the way it's been, and yet we find this difficulty occurring. It's a very common disease, and it is very common for people, especially of age 35, 30, 40, to begin to have this kind of a problem. More common than what you'd think.
As he continues with the presentation to the patient, he not only explains, but he adds credibility to his presentation by using documented material on the subject. He gets the patient personally involved by showing slides of the patient which were taken at an earlier appointment.
I wanted to show you this because this is a booklet from the American Dental Association, and it does document exactly what it is I'm talking about, and it shows rather graphically the progression. And I wanted to also bring in this booklet because this is perhaps one of the best ones, and I want you to take these home with you, but this is perhaps one of the best ones that explains the role of plaque or of the actual bacteria. This is a bacterial invasion. And Paul Keyes is the fellow who has done most of the background for this booklet, and I just really suggest that you give this some good thought. What it's saying basically is just what I said, that the bacterial plaque or the bacteria enters this crevice here and begins to destroy these fibers until it's been destroyed, until there's no more support for the tooth. Now, on the x-rays that we've made, and in looking here at your pictures that we took, as you can see, there's been a tremendous amount of bone loss down in these areas, and all you see really on the surface is this slight area of very bulbous or swollen gum tissues. You see that slight color change in that area, and now you can see some of this yellow material, which is really the plaque that has hardened to form tartar. And this is really the essence of the beginning of the problem. It's right down inside here, and the bacterial invasion is occurring there. The treatment for it, and, well, first of all, I should say that if this isn't treated, and I think it's kind of obvious, actually, from what I've said, but if this isn't treated, this is a progressive disease. It'll continue and destroy all of these fibers until there just is no more support for the tooth. And then when I showed you here, the tooth just falls out.
In the following office, Dr. Mead asked the patient questions which help the patient become more aware of his condition. Dr. Mead continues to follow the steps we outlined by explaining the severity of the patient's condition and the consequences that can occur.
Now, the other thing is, you mentioned to me before that you had a car accident. When was that now that you had that?
1950.
And what exactly happened at that time? How?
Well, I was knocked unconscious. I hit the steering wheel and then the dash.
Oh, yeah. Were those teeth loosened or?
Well, not to my knowledge at the time, but after a number of years went by, well, then I noticed they started to discolor.
Mm-hmm. Have they been sensitive at all? Or?
No.
Have you had any problems with heat or cold? Or?
Very possibly just once or twice, maybe.
Mm.
But
they haven't really hurt
nothing
you?
That continued, no. If it had, I would have mentioned.
You haven't mentioned, or you haven't seen a little spot on the outside along the gum line where you had a little white pimple, like.
If it was there, it didn't bother me.
Mm-hmm. Good. Well, you've been really fortunate because actually what's happened is you have, over the period of years since that automobile accident, you've had some abscessed teeth, and they're caused from those teeth being dislocated and cutting off the blood supply. So the nerves have actually died. So what's happened is they've had a low-grade infection and you've lost some of the bone tissue that's supporting that tooth. And as a matter of fact, you can see here around these teeth, this dark area. This is a large area where the bone supporting tissue has just been dissolved away from the ends of those teeth. As a matter of fact, you know, that were let go for a couple, 3, 4, 5 more years, those would be loose enough so that you might have difficulty with those being lost.
Now that the patient understands the conditions that are present in his mouth, the dentist goes on to the second stage of the model, which is outlining the methods of treatment and explaining the benefits available to the patient. In this scene, we see Dr. Mead continuing his presentation by explaining the treatment procedure to the patient using drawings and the patient's x-rays.
What we'll need to do is root canals on those teeth. And what we'll do in that case is might show you real briefly, if this were your tooth, and this is the nerve inside the tooth, what's happened is the tooth has been hit and has cut off the blood supply right down here, and so the nerve is really dead, and so it really won't cause you any discomfort. What we'll do is we'll take the nerve portion of the tooth out and enlarge the space where the nerve used to be a little bit and put a sterile filling material in that area, and then put a filling back in the tooth, and gradually this area where the bone is lost will fill back in so that you won't have any difficulty with those. Unfortunately, the darkness probably won't get any better. I don't believe it'll get any worse, but right now I don't think it'll be a big problem. If later on we decide that it's a problem, then we can bleach those teeth. But right now I don't think that. Are you self-conscious about those teeth?
No, it doesn't matter to me.
It's not really that dark.
But in mentioning that the bone will return, it'll actually fill in?
Yeah, you bet. You bet. When I eliminate the area of the infection here and get that filled in, the bone will return right back around there and tighten right up as it was before.
We see that Dr. Marcotte also follows this model and includes the patient's involvement in the treatment as well as his own.
What I mean is, in order to arrest this disease and stop it, you're going to have to be able to get down in here daily and clear this bacteria out. Clear out the pus and the bleeding will stop. If you get in and clear out the bacteria, the bleeding will stop, and this is going to have to become part of your life. If you had come here maybe 4 years ago and this destruction had not occurred, I wouldn't have to be as insistent about it as I am now. But now I am saying that you must get in and get these areas cleared, and we're going to be showing you really exactly how to do this. I will show you in our oral hygiene room exactly how to place the brush, and then Barbara or Kathy will stay with you until you can really wrap the floss and understand, get the bristles down, and know what you're doing. So that's the main thing. There will be, after the area is cleared, or after the bacteria is out and the bleeding is stopped, they will begin to look healthier, but I suspect we're going to have to do a little bit of recontouring here in this area, because there's a good deal now of tissue that is useless.
Remove that?
Well, I like the word recontouring, but remove is correct. Because if we don't, and there's a very good reason for it, if we don't, you won't really be able to get down inside here and keep it clean.
Now in Dr. Murray's office, we see him using the patient's models and x-rays to explain the treatment process that is planned. He tells her what he will be doing and how he can improve her oral condition by improving the occlusion.
And secondly, we are going to be concerned about building some chewing function on these back teeth. Now, it doesn't really seem like the lower is involved, but from our standpoint, the lower is very much of a problem because of the way these lower teeth are moving, so that we will be restoring and rebuilding a couple of these lower back teeth, getting them back where we'd like to have them. See, they have all raised up. And then we will approach some type of very probably it's going to have to be a removable appliance again. We always prefer a fixed appliance, a fixed bridge, if possible. But if we do that, we are very limited to how far back we could carry a fixed bridge or appliance that would be able to give you enough chewing function and still not put too much of the force on these teeth that the bridge would rest on.
We now come to the third stage of our model, which is finalizing the presentation. In this stage, the dentist reviews and gives a capsule summary of the treatment plan to the patient. He also presents an estimate of the patient's time involvement and financial involvement. The final step also is to obtain the patient's agreement to the overall treatment plan. We continue with Dr. Mead in the following segment as he presents the final stage to the patient.
The whole ball of wax, including everything that we talked about today, well, we have like the one silver filling on the upper right, and then we have those 3 porcelain type fillings that need to be replaced in the front. Then we have the root canals that need to be done in those lower front teeth, and then the crown that we talked about in the lower right there. The whole ball of wax, including having your teeth cleaned and your fillings polished, everything will amount to like $455. So that amount will get you squared right up to date and straighten around.
In this next scene, we see Dr. Marcotte in the third stage of the presentation, which is finalizing the plan. Dr. Marcotte at this stage talks over with the patient's financial involvement, and includes the aspect of third-party payment.
We'll start off here. It's going to require about 7 appointments, as you see here, and we have the times all outlined. Now, these first initial phases will not require a great deal of your time. You'll be here for perhaps an hour one of the times, but then generally it runs, we have the time scheduled, it'll be about half an hour to 45 minutes from thereafter. And Nancy will be able to arrange these appointments to fit your schedule so that you won't have to take time off work. You can come in when it's convenient for you.
Okay.
There shouldn't be a great deal of discomfort and pain after these appointments. In fact, for all of these, you should feel better when you leave than when you came in. So that is an advantage. I know that you have dental insurance, and so we have done this in an effort to help you. We generally know approximately what the insurance will cover, and I've asked Nancy to already to have submitted what we're going to do to the insurance company, which she's done. And so they are showing here, and this is what the program is. They show here what they will pay and what you will have to pay. Yeah. And so generally speaking, they are paying at about the 85% level for almost all of this work. And your total and your total amount that you will come up with will be $110. And certainly an amount like this, you can take care of it if you like as we go along, or you can take care of it over a period of time. And Nancy handles most of those details. She has guidelines that she follows. Does this all make sense to you? Does it all come together? Well, in that case,
I'd have known earlier.
But you know now. And from now on, we can go forward. Let's not look to the past. Let's look to the future.
Okay.
Let's go ahead. Fine. George, let's make your first appointment. Thank you very much for coming.
Thank you very much.
Good.
What you have seen is our 3-stage model in operation in successful private dental offices. To summarize this model, let's review the 3 stages. The first stage, understanding the problem, which includes the conditions present in the patient's mouth and the consequences if the conditions are not corrected. The second stage is correcting the problem, which includes explaining the treatment to the patient and also the benefits available to him from this treatment. The third stage, finalizing the presentation, is where the dentist summarizes the treatment plan, tells the patient his time investment, also discusses his financial investment, and gets the patient to agree to the treatment plan, or a patient commitment. We have shown 3 rather complicated cases to illustrate our 3-stage model. We want to impress upon you that this model is adaptable to small cases as well as extensive cases. We hope that through the use of this 3-stage model, it will be easier in the future to present the treatment plan to your patients.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.